Welcome to HERcast with Dr. Chito, where we empower women with knowledge and inspire bold action. Today, we explore the vital role of health advocacy in driving better healthcare for all. Our guest, Vivianne Ihekweazu, Managing Director of Nigeria Health Watch with over 20 years of experience in health communication and advocacy. From leading campaigns on maternal and child health to shaping public health messaging during the COVID-19 pandemic, something that we'll never forget. Vivianne has been a transformative force in Nigeria's healthcare landscape. She's also a mentor and advocate for women entrepreneurs and a co-author to an amazing book titled An Imperfect Storm, A Pandemic and the Coming of Age of a Nigerian Institution, a powerful account of resilience and collaboration during Nigeria's fight against COVID-19. Join us for an inspiring conversation on speaking up for health, why advocacy matters, as Vivianne shares her journey and how we can all contribute to a healthier society. Welcome. I'm excited about this episode.
Hello, Dr. Chito.
Welcome. I mean, it's such an honor to have you on HERcast with Dr. Chito. I mean, I've been telling her for a long time that I am definitely going to bring you onto this show because you have a lot to share. And of course, now you're co-author of an amazing book that's doing so well all over the world. So I'm so honored to have you on HERcast. I really am.
Thank you so much for inviting me. I've been watching your show for quite a while, so it's more than an honor and a pleasure to be with you today.
Great. So I want to just kick off immediately and say, what inspired you to transition from a successful career in communications to focusing on health advocacy in Nigeria?
Ooh, that's a very good question. I think, as you mentioned, I run Nigeria Health Watch. We're almost 10 years old now.
Yes.
It's amazing, blinking back. And the work we do is health communications and advocacy. So yes, my experience and my career has been a lot in the communications field, working across FMCG to real estate. So I've worn quite a few hats in my time. But I think the transition to health communication advocacy almost goes back to my initial study. When I was in university, I did economics. And I actually loved economics. Then I kind of transitioned into marketing and business because I also liked that aspect of the work. So I almost feel I've done a 360 in a way, coming back to something I've always had an interest in, which was development economics and how we look at societies and how we look at how people live. But also the health angle has been something I've always had a great interest in. And so in a way, leveraging on a lot of my past experience with communications, and now using that experience to really focus it more on the advocacy part of health, which
is so important.
There's not enough of it in Nigeria.
There's not enough of it.
Yes.
There's definitely not enough of it.
Yeah.
Now, your book, An Imperfect Storm, and I won't say co-authored with your husband, which I think is amazing. It's very inspirational, really, the partnership. Provides a personal and historical lens into Nigeria's response to COVID-19. What was the most profound lesson you learned during that journey? Because I don't think anybody will ever forget the pandemic, and you were out there.
Yeah,
I mean, two of you kind of were out there.
We were. I think, because we've done quite a few book tours. We launched it in August in Abuja.
Yes.
And then we went to Lagos and then went to DC because we were kindly invited by the Brown Pandemic Center. And then we were in London about 2 weeks ago. And each place we've been, there's a question people have asked, which is, how did the book come out and how come you wrote it together? So you're asking, how did we even?
Yes. I like how,
It was almost the book that I started to document some of the stories he was telling me about during that stage. And as everybody experienced, it was a very crazy period for all of us. And I just remember thinking back to the Ebola outbreak when not enough was documented or spoken about. And we said, okay, we overcame it, and we did. But then during the pandemic, there was a lot that was happening at the same time. And thinking through and thinking back to what really were some of the key lessons during that time was what happened if we weren't prepared? A lot went into building up NCDC from where it started when Chikwe took over in 2016. And the lesson, and looking back, I really dread to think what Nigerians don't realize is we didn't have a functional public health institute that could have responded to a pandemic in 2016.
Yes.
So one of the lessons I say, and that for many other things in Nigeria, is we've got to be prepared, and we've got to get the right people in the right seat with the right motivation. So that was, I think, some of the key lessons kind of looking back that really stood out for me.
Oh, that's great. I remember one of those that I think disturbed a lot during that time, because we're all confused and we kept calling your husband Chikwe, like kept calling consistently, like, we have this patient, we have that patient, where do we go? So the information that started coming out and the way things were being shared helped even us in the private sector a lot. And that was very important. Now, I always ask this question about motivation, because I know that for what I do and for being here doing it, I need so much motivation. But what keeps you motivated in the face of the challenges inherent in advocating for better healthcare systems in Nigeria? Because when people talk about advocacy, it's just not always about speaking up or doing stuff towards that. There are challenges that you face in advocating. So what keeps you motivated in the face of those challenges?
I think, from the very starting point of why Nigeria Health Watch was even started. It was started by two epidemiologists who were based in the UK, Chikwe and his good friend Ike. And one thing that was very clear is that, in countries like in the UK and the US, elections are won based on often what the ruling party has in its health policy.
Yes.
It's not the case in a country like Nigeria. Definitely not. Elections are never won based on the manifesto that a politician or political party puts. And that has repercussions. It has repercussions because health is just not prioritized. But there is no how we cannot say that if we don't have a healthy society, we'll have a functional economy. The two go hand in hand.
Yes.
But we don't see it that way. And a lot of the reason why we don't see it that way is it has not been given the right focus, but also Nigerians don't know that they actually have a right to good healthcare.
That's what I'm saying.
It is a fundamental human right.
Yes.
That every human being, mother, child, whoever you are, has a right to good quality healthcare. And because they've never had it, you can't want something you've never had.
Oh, yeah.
So how do you make people better informed, which is part of why we started Nigeria Health Watch?
Yes.
How do we engage with communities? How do we engage with people? How do we provide information so that they too know that they actually have a right to something? So that when they are thinking, of the campaign, when it comes to elections, how much do you demand from, your local governor, your local chairman? By the way, why am I going to my health facility and it's not working? Why is all this money being spent, but my healthcare facility is dysfunctional? They know healthcare workers.
Yes.
So that's what kind of keeps me going, because, I live here. So we all have a vested interest in making sure that our health sector works, because we have family. Even if you live in the US or the UK, Nigerians have family in Nigeria. So no matter what, it will affect
whatever happens here will affect you. No
you can
matter
be
where
living
you
in Canada and then somebody calls you, Uncle so-and-so is not well today. Then you start as a family fundraising.
Yes.
That's one thing we're very good at.
Fundraising.
WhatsApp fundraising has saved countless lives.
Yes.
But it shouldn't be that way. And that's one of the things that keeps me going. The other is I have an amazing team who I love dearly. And they keep me going in terms of their motivation and their energy. So those are some of the things I think that really keep me going in the work we do.
All right.
Yeah.
Let me now focus a bit on advocacy and impact. Now, advocacy can sometimes, and I say this from experience, feel like shouting into the void. Like you're saying the same things over and over again. I may not see the shift that you desire. How do you measure impact and progress in the work at Nigerian Health Watch?
I think some of the things that have encouraged us as an organization in terms of looking and understanding what our impact is. First of all, we started off as a communication advocacy organization. So using our various platforms. So we started off really publishing editorial on a weekly basis. And then that has now transitioned into.
Can I get the emails very regularly?
Yes. That's another thing. That has now transitioned to some of the policy dialogues and events we kind of convene.
Yes.
So going back to the editorial, as you just mentioned, you get out pieces.
Yes.
So when we get asked as an organization, I always get your pieces every week. It really keeps me informed of what's happening in the health sector. And we get these comments from people both in Nigeria and people outside of the country. That tells us that we're doing something right in terms of keeping people informed of what's happening in the health sector. Some of the convenings, we bring together policymakers into a room. Ordinarily, they may not meet, to really have a lot of discussions around the things we're advocating for. That is also encouraging in knowing that at least is having some impact.
Yes, it does.
Bringing to the fore some of these discussions that we're not really having.
True.
I remember in 2018, our annual Future of Health conference focused on the diaspora as a brain gain. Why? Because there was so much about people leaving at that stage. I mean, it's now far more.
It's far more.
But we weren't talking enough about the Nigerians that were coming back. You being one of them. And there are many like you who have decided that, you know what, I want to come back to Nigeria and at least do something. And it's not just about people who come back and say, I'm going to set up shop. There are many who are not in Nigeria, but go back and forth. And really want to remain engaged in the health sector. And it's really great to know now, finally, we actually have a policy, a health workforce policy on migration, which is very, very important.
I need to know that policy.
So that policy, you know, I'm doing government's work for them, but it's an important one. Something that I maybe think is a bit close to me because we are probably one of them that came back. And it speaks to the conference we had in 2018. So that health workforce policy on migration really speaks to some of those issues and gaps that we see that lead to people leaving, but also what are we doing to retain them? I remember before we moved to Nigeria, we lived in South Africa, and they had a similar issue with health workers leaving. But the government was a lot more proactive in actually addressing these issues with the countries that they were going to. It wasn't just a case of come, you know, they leave and then nothing is done by the government. So they were actively engaging with the countries that were leaving. And I used to think, why aren't we doing the same? So seeing that policy come through is really great. But we were already talking about this issue in 2018 and really flagging it up. And we even had a dialogue with the all-party parliamentary group in the UK in 2018 about this very issue. Really engaging and thinking, listen, the UK is attracting many of our health workers. What are they doing to make sure that they, almost it's a quid pro quo. We're taking, so this is what you're getting back. So raising some of these important discussions, were really, really important. So that's, I think, for me, why we do what we do, but also the community engagement. We did some work with one of our funders in 2019 on looking at the reasons why women were dying in communities. So many women don't give birth in health facilities, as you know. This is your area. And there is a gap in understanding why they don't give birth in facilities, but more so, when they die in communities, what accountability measures are put in place to ensure that their deaths are documented? If you die in hospital facility,
we document
there's MPDSR, but in the community, there wasn't such thing. So how do we know why women are dying in communities? What are some of those underlying reasons? So our team traveled to 6 different states across the geopolitical zones. And I remember we took a trip to, it was in Bayelsa. We just happened to go with a clinical psychologist to one of the communities. And she decided to talk to some of these women, most of it in private, because obviously she couldn't divulge what she was discussing. But one thing she said is that nobody had ever asked them how they felt. They were just giving birth. Many of them very fearful about their births. But nobody had actually sat with them and saying, how are you feeling? You're going to give birth. What are some of your thoughts? That's never really part of the discussion. And so part of the report actually talked about mental health.
I think in Igbo they actually call it like a journey. When you come back, they tell you welcome back. Like that means you came out alive. So is that significant?
Yes, because when I had my children in the UK, and I always use this as an example why for me issues around maternal health are so close to me. Because I remember when I had my kids, when I was pregnant, many of my friends actually were pregnant around the same time as we were. And we used to share on a weekly basis. Oh, how many weeks are you? When is your baby due? You always knew. I knew all my friends' due dates. In Nigeria, you never asked.
It's a secret. It's a dead hard secret. But they won't even tell. They won't tell. They keep it like
because
they're scared.
So much superstition
around it. So.
And that superstition, you understand, is linked to people getting so used to having family members, people in the communities dying in childbirth. And if you are pregnant and you go through your whole pregnancy journey, never imagining that something will happen to you, that is a luxury.
Yes.
But it's not the case in Nigeria. People go through pregnancy thinking, am I going to be okay? And that's what we found in the community. So
that's sad.
Having that one-on-one with the women, asking them, how are you feeling? Some of them saying that no, they don't feel enough support. I think that's why a lot of the work we do, especially when you engage with people in communities who don't often get a platform or people even paying attention to them, especially women, is so important. It's a very long answer.
No, but it's a very important one. And it's important because one of the things I even said, like when we were talking, I was thinking to myself, some people, do they even understand what advocacy means? So I don't know if you wanted to just give a spiel of maybe just what does it mean to advocate? And then health space, so that people understand what we're even talking about, the importance of it. Those especially not in some people really don't know anything about advocacy.
It's a very good point. And advocacy can sometimes be seen as activism. It can sometimes be seen as lobbying. But it's on a spectrum. So really, what is advocacy ultimately? Some of the things I already spoke about. Advocacy sometimes is literally just creating a platform to bring people together to share an issue. But often one thing we say when we talk about advocacy is we don't just advocate for the sake of it. We often talk about evidence-based advocacy. So for example, why are we advocating for better maternal health care? Because we're looking at the numbers. We're looking at the data that's telling us that Nigeria is one of the countries in the world with the most number of women dying in childbirth. So we have to use that data and evidence to do the advocacy. So it's important that we're doing the advocacy based on something, which is evidence, which is the data, which is the facts. And advocacy is also what we do in terms of keeping people better informed about what's going on. So we're one of the first organizations to use social media as an advocacy tool. Historically, I think we started way back in 2010, 2013, 2011, using social media as a means to share information about health. And the beauty of social media then and still is you have a wide audience. It enables instant engagement. People can respond, people can share, but you're able to talk about an issue in a platform then that ordinarily you wouldn't be talking about.
True.
So you're able to reach a broad audience. So I think sometimes when we do this advocacy work, I worry that are we in a bubble? Because in our space, everybody knows when we talk about all the acronyms, BACPF, the Basic Health Provision Fund, NCDs, non-communicable disease, everybody, we know those. But outside of our health space, I do know that many Nigerians don't have a clear idea on how poor and how bad some of our health indices are. And that's
just hear like isolated stories, but they don't understand how profound it is.
And if you live in a particular state, you're unaware what's going on in a different state.
Definitely.
I think back to some work we did in 2017 on acute malnutrition. So we did some work in Sokoto and Zamfara back then. Those states were places you could actually travel. And we went to some CMAM sites, Community Management of Acute Malnutrition, another acronym. And we saw children that were severely malnourished. And part of the work then was how do we ensure that the state government at that time fulfills its own counterpart funding to ensure that the children and the communities receive these RATFs. And I was speaking to a friend in Lagos, talking about it, and she was like, "Oh, I didn't know we had malnutrition in Nigeria."
Wow.
She lives in Lagos, so for her,
and where
she's never come across it. And so she wouldn't know.
Because you have to go into the areas. Or even around and see.
But then I said to her, actually, there is actually malnutrition in Lagos, but not to the extreme of some of the northern states. But just be aware that there is a lot of malnutrition in Nigeria, and a lot of children are dying simply because they are not.
And it's worsening now.
It's worsening now.
Because even in the suburbs of FCT, you see kids. I guess also they don't know how to identify this. So for example, we see a child with the kind of hair, we see the stomach, we know, like even when we do our medical outreach, we see a lot of people bring children that are ill, but they're not ill, they're just starving. They haven't eaten and they're weak because they're starving. So by the time you feed them, it's as if you just woke them up from sleep. So yes, I think it's even identifying it. And you're not like, if I live my life in my bubble, I come here, I go to work, private hospital, whatever setting, I never went into the community. I may not have known is this bad.
Exactly.
So I think that's why I wanted you to really talk about that, because even you made mention of the numbers of mothers dying in childbirth. People don't know that.
Exactly.
Because they just look at, I went to this
Hospital.
hospital, I went to this private hospital,
That's
I had
right.
my baby.
Yes.
But they don't know that a majority of women, a lot of women, not saying majority, but a lot of women are dying from childbirth.
Yes.
So I love the fact that we explained that, because I want people to key in and know how important it is to speak up for these issues.
And also, just back to that thing of women dying in childbirth, I think it's unconscionable, the amount of women that die in childbirth.
I know.
I'm thinking like in the UK, if a woman dies, the hospital is a whole...
Because they're young.
It's almost like the hospital is closed down. One woman.
They're mostly young.
And there's a huge investigation. One woman.
Yes.
In Nigeria, it
Definitely.
happens so frequently.
Definitely.
But yet we're not saying this is not normal.
Are we getting desensitized?
We are I sense we are. We must be, because there isn't enough outrage at the number of women that die in childbirth. And it's just not right. Yeah.
Because I think in Nigeria, desensitizing has become a defense mechanism.
Yeah.
So that's why I said that maybe we're just getting desensitized with the numbers. You know, I always tell myself I don't want to ever be desensitized.
Likewise.
Because if you are, you can't advocate effectively.
You can't advocate and you stop caring.
You stop caring.
Yeah.
Yes.
And it could happen to anybody. That's the worst part.
That's true. And that brings this: what role do ordinary citizens play in driving healthcare accountability, and how can they amplify their voice?
Thank you. I think that's exactly following on from what we just talked about.
Yes.
If people don't know, then they're never going to advocate, or they're never going to raise it as an issue.
True.
And the reason why I say it can happen to any of us, I mean, I'm reaching that stage in my life where I've got nieces who are at that point of maybe getting married. So it affects me. I have 2 sons. It could affect them. This could affect anybody.
Yes.
You could even be someone who can afford to go to the best private hospital. But supposing, unfortunately, your wife suddenly goes into labor, or your sister or whoever goes into labor suddenly, and they need emergency care.
Yes.
What do you do?
Yes.
That's why it's important to everybody. And that's why when we think about priorities that we think the government should give more focus to, it's got to be things like this. We've got to be saying, why are so many women dying giving birth in Nigeria? Literally, they're giving life, but they're dying. Why is that the case?
And leaving sometimes little babies. Yes.
Because we know the impact that a mother has on a baby when they're born.
Yes.
And we know the outcome of children when they lose their mother, especially within the first 60 days or even the first 100 days, as we always say.
Yes.
So getting ordinary Nigerians to talk about it more, to ask questions. That's why advocacy is important. And that's why we try as much as possible through the work we do at Nigeria Health Watch to keep people better informed about health policies and just about the health sector in general.
Yeah, and I think another thing I want to say about people, Nigerians here, is that we don't put priority on our health. So if I see patients, they don't put, like patients that can afford everything, they don't prioritize their health, they don't prioritize screening, they don't prioritize health knowledge. So even if you're talking about health, they don't, it's almost like unless they're sick, unless they're going through an illness, they have no business anything about health. And it's so sad, because being health conscious is very important. Like you said, I always say to them is that you must have health, you must be alive and healthy to be empowered. You must be healthy to contribute to anything. Because if you see anybody going through any chronic condition, it's always like you close shop.
But do you think there isn't enough focus on, we focus more on curative health, not preventive or health promotion.
Yes.
So I think the government is trying to tilt more towards health promotion. So people are better aware of, if I'm checking their blood pressure as a basic.
Yes.
But also it's providing avenues for people to also do those regular health checks, preventative health. So it's so important. How is our health sector guiding health behavior?
It's true.
Yeah.
I don't know. I'm just laughing because I'm sorry, because recently I was, one of my working partners, I was talking about, you're beyond, you're up to 60, you have you done your colonoscopy, you have done your mammogram. She's like, nope. I don't want to know.
No.
And I'm like, know what?
Yeah.
I'm not knowing doesn't take it away.
I don't understand that. I don't want to know, because I had an aunt who actually sadly died of cancer, and we were telling her to go for a check. But I think she realized she was really ill, and she actually said, I'd rather not know.
I just don't understand that, because I think that was saying not health knowledge. Like I told her, do you know that the reason you screen, because caught early, your survival is high. You know, she said, but can it stop it from coming? I said, it might not stop it from coming, but if I catch your breast cancer at stage 1, you have a 99% cure rate, 98% cure rate. So then I was not able to convince her. I said, please, I'm okay.
That's
you know, and that was it. End of conversation. So, in your experience, what are the biggest misconceptions about health advocacy, and how do you address them?
I think one of the biggest misconceptions is probably that it's just, first of all, I think sometimes people say, oh, health advocacy, that's like lobbying.
Yes.
And we know, like, for instance, in the US, lobbying often has connotations of you're trying to influence government, you're trying to influence lawmakers. I would say what we do ultimately, one thing we have in Nigeria are a lot of health policies. One thing we push for through our advocacy is implementation. We're very good at drawing up beautiful policies that make perfect sense. But the proof is in the pudding. How are those policies been implemented? So when we talk about advocacy, the advocacy is really that, are you aware that this policy exists, XYZ, and this is what it's supposed to do? How is that now having an impact in improving the health sector in XYZ area? So the misconception is it's not lobbying as per you're doing it for some gain in terms of financial or otherwise. You're doing it in terms of, listen, we need to make sure that every Nigerian has access to good quality healthcare. We need to make sure that government officials who have the responsibility are held accountable. If they say in your state that we're going to make sure that all children from now on are immunized, okay, brilliant, you said it. How do we now hold you accountable to that?
That it must be done.
Because speaking of immunization, if we look at immunization rates across the country, across all the 36+1 states, there's a huge disparity.
Wow.
In some states, immunization for kids who are fully immunized, less than 10%.
What?
I won't name them.
I know, but till now, wow.
But then you always ask, how is that still possible today?
How is that possible?
But it's the case.
With the push, wow.
But it's the case. So that's why awareness is important, and advocacy is equally as important.
And people must own that too.
People must own it.
This is your child. This is your life. So you have to own what needs to come to you. And I think that's because that's what you say about the Western world, is that people demand it.
Absolutely.
So because it's demanded, the leaders or whoever have no choice but to give it.
Try taking away HNS from people. Try taking the NHS away. You will literally start World War, whatever next is coming. Because people have known what it's like to have access to free healthcare at the point of need, from cradle to grave. So try taking that away from them, and you'll see what happens.
That's what I'm saying. All right. I want to go to barriers now and solutions. Let's see if we can answer some of them. So what do you see? And this is, I guess, a very heavy question, but what do you see as the greatest barrier to achieving equitable healthcare in Nigeria? How can we begin to overcome it? Because that's a heavy question, but I just wanted to know.
It is.
Because
it is. We have a population of over 200 million.
Yes.
If we look at the amount of funding that's dedicated to the health sector, it's less than 10%. We always talk about the budget declaration of 2001, where all heads of state in African countries said they'll spend at least 15%. What I have to say to that is actually some states in Nigeria actually are meeting that 50%. States like Kano and a few others. But collectively as a country, are we spending enough on health? But even when we do spend on health, are we using those funds efficiently?
Yes.
Are we making sure that at the different levels in healthcare, primary, secondary, tertiary, are those different tiers working sufficiently? When we look at if you're sick, where should most people access healthcare if your child, for instance, has diarrhea or you suspect you have malaria, where should you access healthcare? That's at the primary healthcare level.
Yes.
But we know that primary healthcare has historically been underfunded. You go to some LGAs, local government areas in Nigeria, and you don't have a functional primary health facility.
Yes.
So where are people supposed to access healthcare? You look at our health outcomes from infant mortality, neonatal mortality, maternal, you name it, nutrition,
yes.
access to sexual reproductive health, commodities, and all the things that people should have access to if they need to get access to family planning services and commodities. That should be at the primary healthcare level. Yeah. But that's not working. And because it's not working, there are repercussions. So people often go to, my child has malaria, so you're going to a general hospital or even a teaching hospital. What does that mean? The cost of accessing healthcare is made higher there. So it's actually more efficient for people to access healthcare at the primary level. It's much closer to them. It's at the community.
Access closer, yes.
So until we get over those barriers, until we get over those structures that don't seem to be working, we are far off from achieving that desired health outcome for all Nigerians.
Definitely. I
think the misconception that people have, because primary healthcare has not worked, people go to hospitals when they're sick.
Yes.
And governors will say, I'm building a 500-bed state-of-the-art hospital. Yes. So they will open this bed hospital, forgetting that healthcare is not a building.
It's not a structure. That's what I keep on
saying.
It's not
a building.
It's not a building.
So you can build we had it in my state where we have so many white elephants that are not open, but so much has been plowed into building the structure. You're forgetting that it needs health workers. It needs equipment. It needs
a system.
It needs labs. It needs a whole ecosystem to make it functional. Yes. So healthcare is not just building 300-bed facility and saying we're doing this. You have to think about the basic.
Yes.
The average mother, the average man on the street, if they're sick, where are they going to access healthcare? That's not in that 300-bed facility where you are not even able to equip it, or you're not able to run it, which happens far too often.
Yes, and one of the things I also think, and this is why it comes back to why this episode is very important, is that people have to understand that we have a role to play. Yes. Because one of the things that upset me when you just talked about this, when you talked about, I think you were talking about the primary healthcare part.
Yes.
I think for me is, you find out that even these general hospitals that they go to, they cannot have access to it if they don't have funds. So this out-of-pocket payments for vulnerable population is a huge problem. But if you're able to, like say, fund the primary health centers, it may be more accessible, definitely more accessible than going to the hospitals that sometimes are far. For example, the community that we work in, you have the Gwagwalada hospital way down there, you have Kuje that's way. So at the end of the day, you find out that the whole not knowing, and there's I don't know if I say people adapt here easily, or it's almost like someone told me, like almost like we call the helpless dog syndrome. Like where you jump at the cage, the cage doesn't open, and then you finally just simmer down and say, whatever comes my way, God help me. And I think that's why we have a very religious community. 100%. Do you understand? Because it's almost like, so someone says, I advocate Chito, I speak, okay, then nothing happens. And then they give up. So one of the things I say, how do we engage them in a way that they understand that there are people like you that can amplify their sound?
I think you're very right in that Nigerians, we are so used to solving problems, because it's literally, sometimes I say, before I even step out of the bed every morning, I'm already solving 5 problems. So we're just built to be resilient in Nigeria and solve, because we often have to just deal with so many issues on a daily basis. And it's the same thing when it comes to accessing healthcare. If your child is sick and there is no functional health facility near you, I mean, many of us are fortunate, that we have that, but the majority of Nigerians don't. And we must not take that for granted, because the average Nigerian, every day they have to now, it's even worse now. You're now facing rising cost of even getting to a health facility, because the cost of petrol has gone up exponentially. So before you now even travel to that hospital, which is probably, I don't know how many kilometers away from your house, you have to think, okay, if you have a car, you have to power it with fuel. Or if you don't have a car, you have to think about transport getting there. So if we have an ability to create platforms for some of these issues to be raised, we should use it. One of the things we do at Nigeria Health Watch, we have our Community Health Watch project, which we started probably about 4 or 5 years ago. And the reason is, I mean, we noticed, as I said, we don't want to be in our own echo chamber and our own bubble. That a lot of the work we're doing, we know we're reaching the same people over and again. But the people who don't have access to that information or have access to our platform are people in communities. So the Community Health Watch Project literally started by we started in Niger and Kano, training community health reporters. So people who are already in those communities to go to some of those health facilities, to engage with people accessing healthcare in those facilities, for them to now share their experience and stories on how they're accessing healthcare. So if you read some of our Community Health Watch reports, you see how people are reporting on how they're accessing healthcare. But beyond that, we also held a town hall meeting in one of the states in Niger. And that town hall brought some of the women who are, sharing some of their stories with some of the ward district committee members, local government, who normally don't listen to these women. They never have that platform to say, by the way, I went to the health facility. Why did I have to bring water? I'm giving birth. I went to have my child immunized. There was no bed for me to even put them on. I had to sit on a bench. That sort of thing. They don't have that platform. So by creating that platform, it literally is, when I say platform, it's a town hall meeting, but convening everybody together so that they listen.
It's very important.
Because if you don't listen, how do you know? And if you don't have that platform to share your stories, as a person, you don't feel empowered. You feel helpless. So it goes back to that syndrome you mentioned of you keep on talking, no one is listening.
And then you just...
So how do we make sure, if we have the ability to create a platform, that they get listened to? Because often, we know women, we don't, it's often the mother who takes her children to the facility. And if she has a problem, who's going to listen to her? So making sure that they feel their voices are heard and their voices matter, I think, is also an important part of making them feel more empowered, more than anything.
You're just giving us a very strong lesson here, because you just put a key into it by saying that one of the most important things is saying that is getting women, or making sure that women feel that they're being listened to. So creating platforms and all that women actually hear. And I think this is also important for leadership, that if you want to make impact, listen. Sometimes they avoid it because they feel they're going to be shouting and anger, but go in with courage and listen.
Even if they're shouting, it's not a bad thing. That's also communication.
Again, that's communication. Listen. And so you can actually make impact. Now, as a mentor and advocate, what message would you give to women looking to lead in sectors traditionally dominated by systemic challenges like the health sector and other things? What advice? Because you're working in its space, so
I think for us in this space, and you're also one of the people who we look to, I think we have to realize that in our health space, we have to keep pushing. For us to make sure that the issues that affect us get listened to and get heard. Why am I saying this? I'm saying this because a lot of the issues that disproportionately impact women are often, we don't have enough. Honestly, we do have, but we don't have enough women in those positions, leadership positions, that can really influence how these issues get prioritized. By that, I mean, we have a powerful voice as women to make sure, and I'm really, really encouraged now that there are so many more groups where women have come together to really highlight and raise some of those issues. I mean, I'll name check some of them, like women in healthcare in Nigeria. I think what's being done on that platform is so many women, so many powerful women.
That brought my attention to, my God,
so many issues,
many different areas.
Healthcare Federation of Nigeria. I'm going to name check here unapologetically because there are some powerful women that are leading some of these groups. And for me, they're mentors to me too. And I think learning with them and also using those platforms collectively, we can raise some of these issues and make sure they get more attention and are prioritized where previously they may not have been prioritized. And I think this hopefully will inspire the next generation of women who are coming up. And if you want to be it, you have to see those mentors there. To see it, you want to be it. So unless you see women in those positions, you don't know you can aspire or rise to that. So I think it's so important seeing a lot more women who are in such important positions, using their voices and using their platforms, hopefully to inspire the next generation of women who I know without a doubt, because I have many of them in my office, really will be advocates for healthcare, especially where it affects women.
And that's important. Now, your journey, as detailed in An Imperfect Storm, highlights resilience and collaboration during the pandemic. How did this experience shape your perspective on balancing professional challenges with personal commitments, especially as a wife and a mother? Now, when I read the book, I think I first was just tripped how you and Chikwe went in and you guys wrote this amazing book together, like you already talked about in the beginning. But I also reading the stories of how, you know, he was out there, you were also doing your health watch, and I know you're an amazing mother, because I know you sacrificed a lot going back and forth and all that, and your wife. So how were you able to balance this and still come out so successful?
Ooh, I think that's an interesting question. I think recently I heard a similar question asked to a leader, and the question is, how do we balance? The honest truth is we don't always balance. It's a juggle more than a balance.
Yes.
Because balance means everything is equal. Which, to be honest with you, it's not. So what we do often, every day you're juggling different balls, and what you do to the best of your ability is not to drop any of them. Because if I miss a school meeting with my kids, I get an earful. Mom, and I do get it. Mom, so-and-so was there, or Mom, you missed my parents' meeting. Or if I miss a deadline for my team or something, then similarly, there are repercussions. So to be honest with you, it's a juggle. But one thing somehow I have learned over the years is you don't always get it right. But you have to sometimes be kind to yourself and know that you won't always get it right. But all these things are equally as important to me. And I'm fortunate that my kids are a bit older now. So I can spend a lot more time focusing on work, because I can tell you for free, when my kids were younger, I used to say that I was a taxi driver. Why? Because I did give up a lot of my time to them then. Unapologetically. Looking back now. I spent a lot of time with my kids when they were younger. You know, schoolwork, just homework, just spending quality time with them. And I know how difficult it is as a mom when you're working and you have young kids. Because especially at that primary stage, I remember my son will come home, you have reading homework, you have maths homework. And that reading homework is actually really important, because I know in Nigeria we focus so much on, okay, my child is 2 years old and they can count 1 to 1,000. That's not necessarily true, or that's not necessarily the thing you should be prioritizing. When kids are young, you should be focusing on building them up. Because, you know, my kids went through all sorts of challenges when they were younger, and me knowing that I could spend that time with them was very important. But at a later stage, they also saw me working, which was also very important, because they got a better understanding and also a respect for our society. Tells them that a woman is a homemaker, and you present a certain narrative. For them to see that thing of the mom actually is working is also equally as important. So that's why I say it's a juggle. All of these things are equally as important, but sometimes you have to push the pedal at certain times in your life, and as a woman, kind of balance and make that decision. And, you know, my husband's work is so complicated that, you know, we've had to move in so many different places, but, you know, appreciate the journey so far and the privilege of being able to work and live in these different places. But at the same time, it's also making sure that no matter what happens, that at home, everybody is comfortable.
That's it.
It's
not easy at all. I have an 8-year-old. I have gaps. I have a teen and an 8-year-old. And sometimes it's stretch in between work. So, I mean, I think you're doing a great job. I'm always like just trying to catch my breath on most days, but hopefully it's not that bad. Now, what was the most rewarding moment for you while writing An Imperfect Storm? And how has the story impacted your outlook on life, leadership, and advocacy?
The most rewarding moment is finishing the book.
When you finally got it done.
I think for me, I'm glad we shared our story. Why? Because we have to own our own narrative. You know what I mean?
Yes.
In the space we work, in global health, a lot of the knowledge often feels that it's coming from the North, global North, as we always use this phrase. But we have a lot to share. Sometimes, I go to conferences and I listen to things people are doing. And I'm thinking, God, we're doing all this in Nigeria already, but we're not documenting it. We don't write enough papers. We're not sharing a lot of our research.
Yes.
I went yesterday to a research symposium that was convened by Farm Access, listening to some of the research studies that were done. We have amazing people in Nigeria doing brilliant work.
Yes, definitely.
We just don't share that enough.
Yes.
So for me, looking back, as hard as it was writing the book, because as much as, as my work involves, doing editorial, writing a book is a completely different ballgame.
I can imagine.
It took almost 2 years.
Oh, wow.
Of weekends in pajamas and stuff writing the book. That's why I said jokingly at the beginning, I'm glad we finished. But I think I'm also appreciative. My husband is extremely patient and very focused. So having that kind of mindset and somebody who's like that really helps. So we finished the book, and it's just nice seeing how people receive the book. And I hope people enjoy reading the book in terms of understanding a bit more about what it takes to build a public health institution.
Yes.
It's not an easy journey. And sometimes when things are not working in government, to get a bit of a background to why sometimes they don't work.
Yes.
And I just hope that, the stories, many people can relate to them.
That's the thing about the book. Yeah. It's so relatable. Yeah. It's so, I fell in love with both of you guys. I was like, oh, this is true partnership. It's very relatable. It's a true story.
Yeah.
That is interesting to read. That's not everybody's true story. This is a true story that was interesting to read, and the way you guided us through the chapters, I think it's an amazing book. All right, so I have the book because I want everybody to see this book that, is with you and Chikwe Ihekweazu, and I think, and he was, of course, the former DG of NCDC. And I think that just reading this and takes you back to the COVID pandemic, takes you back to the whole process, and reading the stories, how you met and all that. I loved, I think I saw one, I think it was a YouTube video where they were asking you who does this and who likes that and who likes that. And that's when I knew that when you talk about your children, I was smiling. I say, because you said that they wrapped you around their finger, right? Anyway, so I'm sure you spent a lot of time with them. But it was a wonderful, I think, story. And I want to ask you in this book, in terms of what you've heard back from people, what is the one thing that really touches your heart that you've heard back about this book, the impact it has made?
I think some of the feedback we've received, a lot of it was, thank you for sharing the story of what happened in Nigeria. Because we don't often get that platform and opportunity. Yes, to say sometimes things go not so well in Nigeria, but sometimes things go well. Well, in terms of having an institution that worked. But also, one thing about the story we wanted to do more than anything is about the people who worked at NCDC. It's more than an institution.
Yes.
And we were purposeful in sharing the stories of some of those people. And some of the people we shared the stories are young people. And, I think back to those days, NCDC, I worked you'll see if you read the book, I worked, I supported the communications team. Nigeria Health was invited at some point to join the crisis communications team.
Yes.
And everybody will know and remember all the communications that was coming out from, NCDC. And you would think it was like some well-oiled, huge PR comms agency. These were just a bunch of young people. Some of them had just finished NYSE.
Wow.
If you remember the infographic that was used to report numbers, the person who did that, I think his story is there, Tijitsu. Tijitsu had just finished, he did his NYSE.
And those infographics are very important.
He did his NYSE, stayed a bit more longer at NCDC, and that was who led that. So my point is, Nigeria has such a young population.
Yes.
We don't often give props to our young people in this country. Or we don't often give them an environment in which they can learn. And that is a missed opportunity. So really, more than anything, people have come, young people who have read this, people who have been NYSE, who have worked at NCDC for a short period of time, who have come in contact, let me be blunt, with my husband at some point, have thanked and been inspired by seeing what happens when people lead with purpose.
Yes.
And that is so important. You
That
lead with
saved our
purpose.
lives
You
during
lead
COVID.
with purpose.
Yes, that
and
saved our lives.
sincerity of purpose.
Mhm.
That is so important. So I think, you know, thinking a lot of the feedback has really been around that. Yeah.
That's awesome. That's so awesome. Now, my final question: what legacy do you hope to leave behind through your work with Nigeria Health Watch and beyond?
Legacy. Oh.
I mean, you have years and years to go, but I will simple. Think of your legacy, and it helps you to know where.
I know it's not a bad
Gives
thing.
you direction.
Oh, I think for me, one thing I want the most for my team and want for Nigeria Health Watch is, it grows and provides people who work there with a space that they can learn, a learning environment where they feel valued, where they feel appreciated, and where they can learn. And that this continues. Because I mean, I lead Nigeria Health Watch now, but I won't be leading it forever because as an NGO, somebody will come in the future. But what I leave behind is an organization that remains focused, I think, in building people, remains focused in being that voice for Nigerians, staying true to purpose and making sure that, you know, the health and the health advocacy we do is really to make sure that Nigerians understand and are better informed about health, but also that they have the information they can use to be advocates themselves.
Yes.
Because we can't do it alone.
Yes.
There are many of us who are in this space. But how do we create a wider audience, more people who are better engaged, think about health as being important enough for them?
Yes.
And ultimately, I think an organization that remains relevant and important in the health sector, I suppose.
Wow. This was a great conversation. Oh, I'm so excited. But I can't wait for this to share this episode with the world. With the world. Wow, what an inspiring conversation with Vivianne Ihekweazu. From her incredible work with Nigeria Health Watch to her pivotal role during the COVID-19 pandemic, Vivianne has shown us what it means to be a true advocate for change. Her insights on health advocacy reminds us all of the power of raising our voices, not just for ourselves, but for the collective good of our communities. If today's episode resonated with you, I encourage you to pick up a copy of her co-authored book, An Imperfect Storm, A Pandemic and the Coming of Age of a Nigerian Institution. It's a powerful account of resilience, collaboration, and hope. A must-read for anyone passionate about health and leadership. HERcast with Dr. Chito empowers women to break barriers, gain knowledge, and thrive. Inspired by my journey, it equips women to overcome challenges and reach their full potential. With the tagline, Her Strength, Your Inspiration, HERcast inspires women to rise and embrace their greatness. You can listen now on all your popular podcasts. Watch us on YouTube, HERcast with Dr. Chito. Follow us at HERcast Podcast and at Dr. Chito N. And watch us on Rapid TV, channel 176 Star Times, Saturday 7 p.m. and Sunday 2 p.m. Remember, advocacy starts with awareness. Speak up, engage, and let's build a healthier, more equitable Nigeria together. Thank you for tuning to HERcast with Dr. Chito. Until next time, stay bold, stay informed, and stay empowered. All right.